Welcome back to Friday's Midday. Ms. BJ Gallent is joining us now from Beacon Behavioral Health. Always great to have you with us.
Thank you. It's great to be here.
Absolutely. Well, we were just talking right before we started. You know, we're technically changing right now when it comes to seasons. We're going into the fall season.
Correct.
And so that kind of brings some challenges.
It does. Changes and challenges. It's very easy. We're transitioning to a different schedules. Schools are starting back. People's off for vacation. They're returning back. Our weather is changing some. There's more activities, after school activities, Saturday activities, ball games, you name it, and it's going on right now.
Oh, yes, it is.
And sometimes that's hard for people to change. They get into that rut and they just don't want to make that change. And so anxiety comes in. Fatigue comes in. They're just, you know, really not ready to get up so early in the morning to get ready for school and the kids off to school. Sometimes depression, you know, will set in, and also emotional strain. And so that's where Beacon comes in, because we can help the families navigate through this center. And we do realize a lot of people are working during this period of time, because, you know, we're 9:30 to 12:30. But for those who are not and they are listening today, it's an opportune time to come and see how to cope and get better coping skills through these challenges.
Absolutely. And so let's talk about, I see some on there, some, I guess some coping skills or some strategies.
Let's build up resilience.
Okay, what's that? What exactly is that?
Let's be able to get up in the morning and say, okay, I've got 20 things to do on my list today. And so how am I going to get through there? Well, we're going to give you those coping skills to help you get through that day. You know, help you make a better list, find out what's important, what's not important. Sometimes those lists can get so long it's overwhelming.
Yes, it is.
And so we have to build up our strength and throw those shoulders back and get with it. Open conversations. Let's have some open conversations. What better place to have those open conversations is in group therapy. Have that support and find out what others who are learning the same coping skills as you are and build on that. Because many times they can say, well, I used to do just what you did, but I changed and this is what I do now. And it's a much better way.
Okay, all right. So great tips right there.
And routines, you know, routines does help that foster that safety just of those day-to-day chores, those day-to-day changes. Stop being so overwhelmed, because that's anxiety is going to bring you down, take that energy level away from you. And here we go. And attention to mental health. Sometimes we want to suppress that, Joanna. We put it in the back of our mind, I'm okay, I'm okay. People ask us how we are. Oh, I'm fine, I'm okay. When actually inside it's like a whirly-bird going on. Depression sets in. We really don't want to get out of that bed every morning, regardless of the weather, regardless of what that list says. So let's join Beacon and find out how we can do a better day.
All right, and how can people get in touch with y'all?
318-589-8397. All they have to do is call me and make one phone call. If they feel like they need inpatient, I can hook them up to Miss Martha Powell as well, because, you know, we have an inpatient hospital in Bunkie. One call, or they can call our office, 318-441-0800. They will connect them directly to me, the staff at the office will, and we'll get you going. You do not have to have a referral from a doctor's office, clinic, or anywhere in town. One call, as I say every month, does it all.
All right, Ms. BJ, it's always great to have you with us.
Thank you so much. It's a pleasure.